On World Health Day 2021, we all reflect on the impact of the unprecedented pandemic which has plagued us all everywhere. And as the World Health Organization puts it, COVID-19 has hit all countries hard, but its impact has been harshest on those communities which were already vulnerable, who were more exposed to the disease, who were less likely to have access to quality healthcare services, and who were more likely to experience adverse consequences as a result of measures implemented to contain the pandemic. Each country sought to carve out its own particular path in fighting the pandemic. The Jerusalem Press Club is proud to offer you a glimpse into the special way Israel has fought COVID-19, mobilizing the heroic commitment of its medical crews, the innovative spirit of the startup nation, and the solidarity which has always been the secret weapon of Israeli society in times of crisis. This is Israel's COVID-19 success story.
Hello everyone, my name is Dr. Sharon Alroy-Preis, and I'm the Director of Public Health Services in Israeli Ministry of Health. I welcome you to this video on World Health Day. This past year has been a challenging one. Israel, as most countries, has faced COVID-19 pandemic, and it was tough. It was a tough year. We lost over 6,200 people to this pandemic. We had 3 disease surge that required us to go into lockdown with all their immense social and economic impact, the consequences of which are still for us to deal with, consequences for kids and adults alike. And we will be dealing with them in the months, maybe years ahead. And the pandemic is not over yet. We're still with our masks and social distancing, and it's not over. But in this challenging year, we saw the public health system and the public health care system in Israel and its greatness. We saw an ability to track and investigate all cases. I'm very proud of our public health system. We saw the ability to take care, both in hospitals and at home, for thousands of people with COVID-19, and the mortality rate was very, very little. We moved quickly into telemedicine capabilities. And the vaccination campaign, that's a huge pride. Since December 20th, we were able to vaccinate over 85% of our eligible population. And that is due to our healthcare workers and to the public who came to be vaccinated. And so now, due to this huge effort, we're able to open up economy and still see how the infection rate goes down. And so for this World Health Day, we wanted to put some spotlight on stories of people who devoted themselves and sacrificed a lot during this struggle. And their sacrifice has made a difference. And we wanted to share this with you. And finally, I wanna take this chance and salute our comrades across the globe and share best wishes for all of us for this pandemic to be over and for all to go back into good health. Happy World Health Day.
Like all hospitals around the world, we had a very challenging year treating COVID-19 patients. At the height of the first wave, we had 3 active medical departments and 1 intensive care department treating COVID patients, with many staff members engaged in the treatment. Some of them, including myself, contracted COVID-19 whilst treating. We had many challenges during this year in many fields. Some of them were logistic challenges in building new departments. Some of them were ethical challenges about choosing who should get which treatment. For me, The most significant challenge was the uncertainties in the medical treatment. And as doctors, we had to navigate and negotiate what we think is appropriate treatment compared to what we think is inappropriate treatment. That was very challenging for me. This unusual situation, unusual year, gave an opportunity for different types of collaboration which aren't usually heard of. For example, we collaborated with Israeli special forces in developing a special mask. We also entered a lot of studies with biotech companies in diagnostics and treatment for patients with COVID-19. We entered a new realm which is unfamiliar for us, of treating patients by far, and telemedicine, which we were unacclaimed for. But even though we tried to develop all these things, we always had to have a person inside. We always had to have the staff member being with the patient, talking to him directly, making eye contact, even though they could not see our smiles or frowns, touching the patient. There was no way around that, and there was no way to properly treat patients the way we want to without being there and holding their hands and talking to them. One of the challenges we see now is being able to vaccinate the whole population. We have a small but still very significant group, especially young people, who are avoiding getting a vaccination because of different fake news that they're getting about these vaccinations. And it is important to explain to them and to reach out to them and to have them get vaccinated so we can avoid the morbidity and mortality that is involved even in a younger group population, and we can eventually manage to eradicate this terrible pandemic that is engulfing us over the past year. One of the things that personally gave me encouragement in continuing this difficult work was meeting the patients we treated, patients in critical situations, patients on ventilation, patients on dialysis, and meeting them outside of the hospital and seeing how they recovered. I still stay in touch with a few of these patients, and this is what really gives us as medical teams the force and the encouragement to continue this sometimes very frustrating job in treating COVID-19 patients.
In this study that we've conducted at the Clalit Research Institute with our esteemed colleagues at the Harvard University, Miguel Hernan and Mark Lipsitz, as well as Ben Rice from the Boston Children's Medical and the Harvard Medical School, we were able to assess the vaccine effectiveness against severe disease and symptomatic illness. And we've been able to demonstrate that the vaccine is exceedingly effective as it was in the clinical trial. It reduced 94% of the symptomatic illness and 92% of severe illness among different population subgroups of all ages. This study that was performed in Israel at Clalit would be able to demonstrate for decision makers and the public worldwide that mass vaccination campaigns have a huge potential in controlling the illness globally, as well as curbing the detrimental impact of disease dissemination on human lives.
I-24 News is taking you inside the massive Sheba Medical Center right near Tel Aviv, the largest hospital in the country, to get a close-up look at its coronavirus units and how a dedicated team of doctors and nurses around the clock are handling this ever-rising number of new corona patients during this deadly second wave.
These corona patients are between life and death. Some of them receive respiratory assistance, some others don't. But all of them were placed in intensive care units in the special coronavirus unit of Sheba Medical Center, located near Tel Aviv.
Which patient? Which one? Number 12? Here you see the nurses who are inside the unit. Doctors are there on this side. We talk with them thanks to walkie-talkies, and when needed, we also go inside, totally protected as you can see. We all have these uniforms that protect us from head to toes. Fortunately, the second wave is not as grave as the first one was. There are less patients who receive respiratory assistance. We have more drugs that we can use, including some of them whose efficiency was already proven. Let's say that we control the situation a bit more.
In this unit, there are almost 40 beds and medical teams that have taken shifts day and night since the beginning of the pandemic in Israel in March. This unit was set up in just a few days in an underground parking.
The red zone where the COVID patients are isolated, and the green zone where staff can be dressed like me and protected in normal precautions.
Here, the medical staff is already considering the worst-case scenario, with winter 2021 in sight and the flu season.
As we are going into the winter of 2020-2021, we anticipate a wave of both flu patients and COVID patients, and we anticipate to be in a challenging situation. The problem is not the equipment. It's very easy, or it's relatively easy, to have enough equipment to treat hundreds of patients. The problem is personnel that has the training and experience of treating severe patients. We have 200 more beds like this that are ready in another parking lot.
Dr. Leshem is worried by the lack of qualified staff, and some of them even begin to feel very tired.
I wish everybody was in good health. I wish we could all get out of here. I've been very depressed lately. It's very difficult to work inside, to be in contact with the patients, to be protected this way without being able to breathe properly. It's hard. I've been working in the medical sector for 18 years. I'll soon be 60 years old, but I really wanted to volunteer.
In this underground parking, the medical staff can take a break and rest a while before returning to the corona unit and taking care of patients. And they need it, because the number of serious COVID-19 cases keep on rising every day and puts the Israeli healthcare system to the test.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. The best lessons, I think, on how to get prepared are, again, what we do for war. We need a medical reserve corps, and then we need to pair those medical people with the military, taking advantage of the military's ability to move fast, do logistics, and secure areas.
Israel quickly rolled out its vaccination campaign with more than 250,000 Israelis vaccinated in the first week.
The army with the highest percentage of vaccination.
A greater share of its population than any other country.
About a year ago, I received a call to come to a meeting with my head nurse to meet with Professor Roni Gamzu, who is the General Director of the entire medical center. This was at the beginning of the corona pandemic, and it was just recently, it just recently came to Israel. And another hospital was treating the patients, and we were charged with the mission to set up a department for taking care of the COVID patients, of these corona patients. We had a meeting, and we started to get the idea that this was going to be a major project. Not only do we have to worry about how to care for the patients, we had to worry about
setting up an entire department, setting up the logistics, setting up the engineering. How to make it possible so that when you open the doors, the air flows in instead of flowing out. That's just one example of all the things we had to worry about. We had to be able to go in with the personal protective gowns and gloves and face masks, learn when we needed them, how to put them on, how to take them off in a safe way so that we wouldn't endanger ourselves. We had to be trained ourselves, and we had to train our staff. And then on a Saturday night, as I'm on my way into the hospital, I get a call from one of the assistant directors of the hospital, Rutis Esportis, who says to me, our first patient is on the way. And I was on my way to the hospital. We were all ready to go. The patient arrived. We were able to see her and to take care of her. And things were going quite well. But since this was the first for us in the hospital, certainly the first for us in the department, there were many things that we had to learn on the fly. We had to figure out how to go in and how to communicate with the staff that was outside. How do we make sure that we can communicate with their families, us as caregivers, and how can we make sure that the patients, can communicate with their families? Picture this, as I tried to portray before, that the patient is in there, again, frightened, maybe physically very ill, extremely scared, alone, completely alone. No communication with his family, difficult communicating with his caregivers. We started working out electronically, at least, so that the patients could use their cell phones, or we had a tablet that we would bring into them for the patients who didn't necessarily have their own equipment. One of the things that was very, very difficult for us, very painful for us, was the fact that patients were dying, and they were dying alone. They had no communication with their family. Perhaps they were in the room by themselves, and they died. Perhaps with us as caregivers next to them, but not with their loved ones. One of the situations that I will never forget was a situation where a patient came. He was very sick. He came into our department. We had to do resuscitation from the beginning, and the patient died. Very quickly, his family came to see what was going on with him. And that was the point where I had to tell them that their father had died. They didn't know anything about what had happened beforehand. That's what I had to tell them. I had to do it standing up. I had to do it being protected at a distance from them because they were also exposed to corona. And then I had to tell them that if that's not bad enough, they're not going to be able to see their father. That was one of the situations that was extremely painful, and one of the things, as I said, that I will never forget. An idea was hatched that we would find a way to protect families and to bring them in to see their loved ones as we got the sense that this was near the end. And we were charged with putting that together, and many people were involved in putting together, from the highest levels of the administration to the doctors, the nurses, the social workers, putting that together, bringing the families in and being able to make that happen. We were the first place, the first hospital, the first medical institution that was able to put that together and do that in the world. And as I look to the future, I see points of light on the way. Patients are starting to become vaccinated in vast numbers. Here in Israel, we have over 5 million people that have been vaccinated. This is the ticket. This is the ticket to having control over this disease, over this horrible pandemic. This is the ticket for all of us to get back to normal life.
Hillel Yafa Medical Center, based halfway between Tel Aviv in the center and Haifa in the north, is named after Dr. Hillel Yafa, who had fought to eradicate malaria in the early phases of Zionism. Continuing this vision today, Hillel Yafe serves the most heterogeneous population of the country, Arabs and Jews, city dwellers and farmers, with an equally multicultural medical staff. As such, the medical center serves as an exemplary model for peaceful coexistence between Arabs and Jews, based on mutual understanding and tolerance. In recent years, it also shines as an example of further diversity, as a hub of absorption of immigrants from the former Soviet Union, Ethiopia, and other countries. The location of the Hillel Yafe Medical Center at the heart of the country's major traffic routes make it the go-to hospital for treating injuries caused by car accidents, producing many professional and organizational challenges. Furthermore, the center has one of the leading ERs, and unfortunately has had ample opportunities to prove its state of readiness in times of terror attacks in the region. However, COVID-19 presented an unprecedented challenge for the otherwise experienced doctors and nurses, lab workers, and others. The lives of medical staff and patients are often intertwined in the most mysterious ways. Dr. Medlej Dua, age 27 from Kafr Kara, was nearing the end of her internship in medicine at the Hillel Yafe Medical Center, and herself contracted the virus. When she recovered, she returned to work in the Infectious Diseases Aid Department, where confirmed patients are hospitalized. But she never imagined that her father, Nadir, would be hospitalized in the same department after his condition had deteriorated. Dr. Medlej relates, "I waited to already get back to the hospital, particularly to the Infectious Diseases Aid Department. I am well aware of the heavy physical and mental load carried by the staff, and as someone who had and recovered from COVID-19, I feel safer and want to help the medical staff, and of course the patients themselves, as much as possible. This disease is much worse than I had thought. When you suffer it yourself, it's not the same thing as seeing someone else suffer." Regarding her father, she said, "I am happy I am near my father, and I tried to help him as much as possible." What a year it was for both patients, doctors, and nurses at Hillel Yafe.
הקורונה הכתה בכולנו. אוכלוסיית הזקנים נפגעה במיוחד, ולכן הבנו שאנחנו נדרשים להתאים את כלל עשייתנו בג'וינט אשל לטובת זקני ישראל. ג'וינט אשל פעלה במהלך הקורונה ב5 ממדים. בממד הראשון סייענו למשרדי הממשלה. משרד הרווחה העניק בחודשים הראשונים מזון מבושל לזקנים שהיו ספונים בביתם, ובנוסף, באמצעות כספים שגייסנו מקרנות בארץ ובעולם, אפשרנו לרשויות המקומיות לתת למתנדבים כסף לטובת סל גמיש שאפשר להם לקנות דברים עבור הזקן שלעיתים נשברו לו המשקפיים והוא זקוק לתיקון ואין מי שיעזור לו יעשה את זה עבורו. המטען של הטלפון התקלקל וצריך לרכוש מטען חדש. בנוסף, הכשרנו עבור משרד הבריאות בפרויקט מגן אבות ואימהות בצורה יחסית מהירה, אנשי מקצוע נוספים, מטפלים, עובדים סוציאליים, אחיות וכדומה, שיוכלו לעבוד במוסדות הגריאטריים ובבתי האבות. והענקנו תמיכה רגשית ומקצועית בעובדות הסוציאליות שהיו זקוקות בתקופה הזאת להעצמה משמעותית. סייענו למשרד ראש הממשלה בהובלת השולחן העגול הבין-מגזרי. עסקנו בכל הנושא של מתן מענים ותכלול המענה ב5 נושאים חשובים שהגדרנו אותם כקריטיים לזקנים בתקופת קורונה. אחד העיקריים בהם שגם ניתנו בו מענים טובים היה הנושא של בני משפחה מטפלים. בממד השני התאמנו את פיתוח השירותים שלנו לתקופת קורונה. למשל, פרויקט משגב, מרכזי שיקום גריאטרי ציבוריים בקהילה, פיתחנו שירות של שיקום מרחוק. את מרכזי התעסוקה ומרכזי ההכוון אפ 60 פלוס והכלים שאנחנו מעניקים בהם, אוריינות פיננסית, אוריינות דיגיטלית, אוריינות בריאות, העברנו ליכולת ללמוד ולבצע את השירות מרחוק. בנוסף, מיזם גדול להתנדבות אצל ניצולי שואה, עכשיו זה הזמן, העברנו ממפגש בנוכחות ל3 שיחות טלפוניות כל שבוע בין המתנדב לבין ניצול השואה. בממד השלישי, הקניית ידע לאנשי מקצוע. הסבנו את מרכזי ההכשרה של אשל ללמידה מרחוק, והתאמנו את עצמנו לבקשות של משרדי הממשלה, של גופים וארגונים גדולים, בהתאם לצורך. בנוסף, הפקנו 23 סרטונים ייעודיים לאנשי המקצוע, לבני המשפחה המטפלים ולזקנים עצמם, ויצרנו מספר חוברות ייעודיות לטובת נושאים ספציפיים בתקופת קורונה. הוספנו עליהם כתוביות באנגלית, ברוסית, בערבית ולעיתים גם באמהרית. באתר של אשל הוספנו סביבה יהודית שקראנו לה זקנה בימי קורונה. כל החומרים נמצאים שם. הממד הרביעי שהתרכזנו פה בג'וינט אשל היה לתת מענה מיידי לצרכים שעולים מהשטח. הפקנו באמצעות מרפאות בעיסוק ערכה להפגת בדידות ולהפעלה גם פיזית וגם קוגניטיבית, שאותה הפקנו במספר עשרות אלפים עבור זקנים שנמצאים בביתם או במוסדות, ובנוסף אפשרנו לקיים אירועי תרבות בעשרות רבות של בתי אבות ושל מרכזים גריאטריים. בממד החמישי בחנו את המצב, ביצענו 2 סקרים, אחד במאי ואחד בספטמבר, שבו בחנו מהם מנבאי החוסן בתקופת קורונה ומהם מנבאי ההידרדרות. הגדרנו אותם, למדנו אותם, שיתפנו אותם עם המשרדים שגם לקחו את התוצאות האלה והפכו אותם לתוכניות יישומיות בתקופת הקורונה על בסיס נתונים ומחקר איכותי ומתמשך. לסיכום, פעלנו בג'וינט אשל במהלך הקורונה ב5 ממדי פעולה, להתאים את עצמנו למציאות המתהווה, ואני חושב שהצלחנו להיות ארגון סופר משמעותי עבור הזקנים, עבור בני המשפחות, עבור המערכות הלאומיות, ולרגע לא הפסקנו את הפיתוחים החדשים שלנו, והתאמנו אותם למציאות המתהווה שחלקם יישארו איתנו גם שנים רבות לאחרי הקורונה.
Welcome. We are pleased that you can join us at Startup Nation Central's studio in the heart of Tel Aviv. As parts of the world move toward a post-pandemic normal and other countries are still struggling, we wanted to share a story with you, Israel's story. Israel is known as the startup nation for its tech prowess. Among the stronger innovation sectors is digital health. On this slide, you can have a quick peek at what are some of the building blocks of the digital health ecosystem. You have the 25 years of accumulated electronic medical records, the fact that it's a very dense healthcare system. We've got only 4 HMOs serving the entire population, the core technologies such as AI and machine learning, a very strong national support infrastructure, and of course, the people, which are the entrepreneurs at the very heart of the story. This is what the digital health sector looked like in March of 2020 when this global pandemic hit. Now, what happened is that there was quickly a trigger for numerous health tech companies to pivot towards solutions in the battle against COVID. Now, we have with us Startup Nation Central's Senior Digital Health Analyst and Sector Lead, Lena Rogovin, who is going to help us unpack what happened in the tech ecosystem here, particularly in digital health in the last year. Lena, before we get to Corona Tech per se, can you just spend a minute on what are some of the sweet spots of Israel's digital health sector?
Sure. Hi, Wendy.
Hello.
Good to be here. So as you mentioned, it's all about deep tech, the combination of accumulated digitalized medical data and strong expertise in artificial intelligence and other advanced technologies provide a basis for this sector development and growth. And the core of Israeli digital health companies are the companies utilizing AI to analyze huge data sets of EMR to develop solutions for diagnostics or decision support. And this decision support, diagnostics, as well as remote monitoring became super relevant in the time of pandemic and in this so-called new normal, which led us to accelerate the trend of decentralization of healthcare.
Right. No, decentralization is definitely a big part of the story of what happened last year. Perhaps you can share with us in what we call this Corona tech space itself. What are some of the technologies that were developed this past year? How were they implemented? Maybe even give us 3 that you think are super interesting to watch.
All right. So all in all, we have defined about 300 companies which are relevant for so-called Corona tech. Most of them are obviously health-related. And if you want to choose top 3,
let's
difficult.
Not say top 3, because I know it's hard.
Just 3 companies.
It's hard to rank from your 600 favorite children.
Exactly, that's the point. So I would mention first the company called K-Health, which is, by the way, the first pure digital health unicorn in Israel. The company just raised $132 million at $1.4 billion valuation.
Wow.
Yes, it's very impressive. So this company started as an AI-driven chatbot, mobile app.
Wait, just take us right there. An AI-driven chatbot. Say what is that? What does that do?
It's a mobile app which asks you questions about how you're feeling. The same questions that your primary physician would ask you, and based on your answers, gives you the most likely diagnosis. So that's how they started. And over the past year, they have developed into full-scale telemedicine company, employing its own physicians and active in the US market and Latam markets in Israel and expanding in additional markets as well. Another company is Untitled Chapter. This is a primary diagnostics, a primary examination company, which provides home use diagnostics toolkit.
Now that's that's the wave of the future, right?
Absolutely. That just replaces emergency room visit. They started with the solution for mostly for pediatricians, and now they expanded into primary care in general. And this is arguably one of the most successful startups of 2020. They now service more than 150 clients all over the world, including US, South Africa, Europe, Turkey, Israel, you name it. And the last but not least is decision support AI-based company called Diagnostic Robotics. They do medical triage or prioritization of patients. During Corona, during the first lockdown, they worked with the governments to create heat maps to predict next COVID outbreak. Now they're back to their core use case of working with outpatient.
I understand those heat maps are really critical for some of the first responders in
Exactly.
terms of where exactly
to put the resources and
exactly. Well, this has been fascinating. I know that you and your team prepared a landscape which shows all of this 300 COVID-related startups in Israel. Where might one go to find that?
Startupnationcentral.org. That's our website. On the resources page, we have all our research, maps, blogs, articles, everything you might want to know
Okay,
about
so that's
the
startupnationcentral.org. And of course, there's the Startup Nation Finder, which is Startup Nation Central's platform, where you can go and just put in Corona Tech, and that's its own separate tag. Lena, I want to thank you for joining us. This has been a fascinating window into this less told part of the Corona story, and I can only wish you good health.
Thank you, Wendy. Likewise, my pleasure.